Do you want to be healthier, yet you just don't know what to do? All these shows telling you this and that, but nothing seems to work. Well, listen close. Golden State Media Concepts has got something great for you. The Health and Wellness Podcast dedicated to workout trends, healthy eating habits, diet, and everything about healthy living. Join us in our banters as we help you not just live life to the fullest, but live it to the healthiest.
GSMC Health and Wellness Podcast, brought to you by the GSMC Podcast Network. I'm your host, Alex. Today I want to talk a little bit more about osteopathic medicine. So in a previous podcast episode, we discussed at the very end about the difference between chiropractors and osteopaths. So today I want to go a little bit more in depth in that regard to help you guys find out if maybe an osteopath may be right for you. So first up, let's talk about what an osteopath really is. So what is osteopathic medicine? It's a very different way of practicing medicine, primarily in the U.S., and it's not an entirely Western approach. So the regular medical doctors that you may see, they practice allopathic medicine. That's what we really are talking about when we say Western medicine a lot of the time. Whereas osteopathic medicine is still able to offer you what modern medicine does. So you can still, have surgery, prescription drugs. They use MRIs and x-rays and such to really diagnose you and evaluate you. But it also has more of a hands-on diagnosis and treatment methodology. And they will actually spend more time talking to you about what's going on with you holistically, because osteopaths believe that your emotional wellness and social wellness and your mental health all tie in with your physical health. They think that everything is holistically connected, just like we tend to treat it in this podcast and in anthropology. So I'm a big fan of the concept of osteopathic medicine, although I've not been to a D.O. myself to experience that. As I told y'all before, I generally go to a nurse practitioner because she is very awesome and I found a doctor that works for me, so I have not sought out another one. But if I were to seek out another doctor, like if I moved really far away or something, I would try to look for a D.O., I think. So with the D.O., the Doctor of Osteopathic Medicine, they can do anything that an M.D. can. They just tend to be more hands-on. And by that, I mean literally hands-on. They do think that having, physical touch is also very important with the bedside manner and with helping to diagnose and evaluate the patients. So if you don't like to be touched, if you do go to a D.O., maybe let them know that, see if they're still fine with that, or maybe stick with the M.D. It's just going to depend on finding the right doctor for you. Now, with the osteopathic medicine, it emphasizes the individual patient rather than treating everyone as just, okay, this is the same cluster of symptoms, I recognize this again. So they're trying to help you achieve overall wellness and not just health care, or, in the U.S., a lot of times it's just sick care. So they're really focusing on promoting your overall health and wellness and preventing diseases in addition to treating you for whatever you have come in for that day. Now, we do have a physician workforce shortage right now. According to the Association of American Medical Colleges, the AAMC, they think that by 2025, we will have a gap between supply and demand of doctors from 34,500 to 88,000. So we're going to need about 35,000 to 88,000 doctors that we are not going to have. I think that that is very interesting. I think a lot of the problem is, school costs in general. It's really expensive to go to college at this point, and you're looking at a long period of paying back student loans, even if you do go, because it's really difficult to attend without taking out student loans. Going to school today is not like it was when our parents and grandparents went to school. So, they are having a real shortage of that, but there are more and more colleges of osteopathic medicine popping up as time goes on, and they're graduating more students each year. So if you maybe in the past wanted to be a medical doctor and decided that wasn't for you because you're more into homeopathy and a holistic approach, you could perhaps become a D.O. They're pretty cool, and I like their programs a lot. They're very centered on student wellness as well. So a lot of graduate and postgraduate programs, they kind of have this mindset that they just expect you to be really upset and that your mental health is going to degrade because you're going to be so stressed out, and that's just what college looks like for grad school and postgraduate programs. But with a lot of D.O. schools, they really do emphasize taking care of the person as, the student as a person, and in making sure that, they have the available resources that they need to really be successful, and they emphasize self-care. Honestly, it just seems like a really cool program. I've clearly looked into it a couple times, but, from the student perspective, but it's really interesting to me. And they also emphasize that as a profession. So their perspective is that you can't really be great about treating someone else from a holistic perspective if you're not holistically performing self-care as well. So I really like that about osteopathic medicine. The programs really seem to, walk the walk. They don't just talk the talk. And I enjoy that in a doctor. I like that is what their field is kind of based on. So just like M.D.s, they can do any prescriptions, surgeries, etc., but they can also do osteopathic manipulative techniques. So like massage types of therapy and helping you with joint and just general musculoskeletal conditions to improve your wellness. So where did osteopathic medicine start? It was founded in the late 1800s in Missouri by a medical doctor who felt that medical practices in Western medicine were causing more harm than good at the time. So he wanted to focus on a way to help the body just work on its own innate ability to heal itself. So, if you get a cut and stuff, a lot of times nowadays, we just wash it out and then it heals itself. That's really what he noticed, essentially, and what he was a proponent for. Our bodies do often heal themselves. Now, I've said it before, I'll say it again. I am not saying that this is that homeopathy in general can prevent everything. Homeopathy, I think, is great for a lot of things. Lavender and melatonin and stuff if you're having trouble sleeping. But also, if you have something that is bacterial in nature, it's probably a good idea to get antibiotics. That's my personal perspective, and that's kind of how osteopaths work as well. They work in partnership with their patients as well. I really like that. If you've ever been to an M.D. and you felt that they didn't really listen to you, you really might like a D.O. They think about the impact that your lifestyle and the general community that you're in have on your own health, and they will prescribe not just medication, but they'll also recommend that you perhaps take up yoga or meditation to work on your overall stress, especially if you're having tension headaches and such. So your muscles are bunching up because your muscles are tensed from being stressed out all the time. So that is one way that they approach it that's going to typically be a lot different from an M.D. On their very first day of medical school, they are taught that they need to look at the whole person. So you are more than just a collection of organ systems and body parts to them. You are not just a meat sack that has been injured or is ill at that point. You're not a collection of symptoms. You are a person. And there is more beyond just what you've come in for today that may be impacting your overall health. So when they do this, they have to go ahead and integrate the real patient, you as a person, into the healthcare process as being a partner. They're not just sitting there lecturing you and telling you what to do. They're asking you for more information because no one knows your body better than you. They're trained to really care about inclusiveness and diversity. Overall, I think D.O.s are really well trained as humans. They are almost anthropological in nature as well. And then they practice these skills in their classrooms and learning labs in addition to, just their book work before they finally get to practicing with patients. Now, they are strongly rooted in primary care. So primary care practitioners, that's where a lot of osteopathic medicine practitioners end up going. And they make a really good physician. That's their goal, is to make them a good physician and one who is very patient-centered. In patient care and healthcare, you'll often hear the term a patient-centered practice. And that's really what osteopathic medicine is in general, just as the entire field, not just as an individual office. So when you're moving towards osteopathic medicine, more than 1/3 of the osteopathic medicine graduates go ahead and choose careers in primary care. So just, your family doctor. They also have a special focus on providing care in rural and urban underserved areas because, again, they are mindful about diversity, inclusivity, and they care about factors like socioeconomic status that perhaps a lot of M.D.s don't typically tend to focus on as a field. They also have a really great impact in this regard on the overall U.S. population, like their health and our wellness, than their numbers might really suggest, because you don't really hear about D.O.s a lot, but they're there. Over the past few years, more than 1/3 of osteopathic med school graduates said they plan to practice in rural or underserved areas. So I think that is really admirable as well, and I really like this concept. 1 in 5 medical students in the U.S. right now is actually attending an osteopathic medical school, not an M.D. So 4 out of 5 are still attending M.D. programs, but this is growing rapidly. 20% of our current medical students in the U.S. are going for osteopathic medicine. All right, we're going to go on a quick break, and when we come back, we're going to talk about their curriculum and their research.
Are you looking to learn more about the latest trends from the fitness world? Are you confused by all of the different trends that are out there? The GSMC Fitness Podcast is the place for you. The GSMC Fitness Podcast is the place to come for people of all skill and interest levels. Join us as we explore the latest trends in the fitness world. Does that new exercise really work? Should I try yoga? Whatever your question, chances are good you'll find an answer on the GSMC Fitness Podcast.
Welcome back. In our last segment, we were introducing the concept of osteopathic medicine and osteopathic med schools. Now we're going to talk a little bit about what they study. So in addition to everything that regular medical students, or M.D.s, I want to call them regular, D.O.s are on the rise. Traditional, I would say, Western medical students, allopathic physicians, are studying. The osteopathic med students take about 200 additional hours of training in osteopathic manipulative medicine. So they are, moving your musculoskeletal joints through mobilization and, just range of motion activities, as well as, kind of a physical therapy type approach as well to help alleviate pain. It'll help you restore motion in your body and just support your body's natural functions to help it work more effectively. one really key component that they study is that structure influences function. So I've discussed before about how anatomy and physiology is the study of structure and function. Anatomy is structure, physiology is function. So they believe that how your anatomy or your structure works influences how functional you're going to be, or how the rest of your systems are going to work. Not just for mobility, but also for your organ systems. So if you have one problem in one part of your body structure, then the function in that area, and perhaps even other areas, may be affected. Another thing that they look at is really the body's ability to heal itself. A lot of the osteopathic medicine techniques are aimed to reduce or eliminate things that really stand in our way for having proper structure and function. So they'll even talk about your nutrition. You'll talk about exercise goals and such, your personal social support system, your emotional wellness, because they believe in the mind-body connection very deeply. So in addition to being, primary care practitioners, D.O.s can also do clinical and basic scientific research to work on the frontiers of medicine. So they do osteopathic clinical research with different centers, and they conduct multi-center collaborative clinical research studies. That's really important for scientifically and empirically, showing the efficacy of their work and showing that, hey, osteopathic medicine definitely has a real basis in science and everything as well. Now, I say that because in science, we just like to have a lot of data, but D.O.s are clinically recognized as being physicians just like M.D.s. They can do all the same things. They just approach things differently. So I think that it's really interesting how that works. And nowadays, with osteopathic medicine, we've gotten to the point where they're accredited and they have to go through accredited residency programs just like M.D.s to really get, to be a real physician at that point, to be a full physician, just like M.D.s. So when it comes down to it, let's really talk about the difference between an M.D. and a D.O. So a lot of folks see a primary care physician or a family physician for general health care, and there's a chance that you're seeing a D.O. and not an M.D. when that happens. Both degrees mean that your doctor's a physician. They're totally licensed. You don't have to worry about that, but their training's a little bit different. When you go to see a D.O., then they're going to look at the mind-body connection, whereas allopathic medicine or M.D.s, Western medicine, tends to just focus on treating disease symptoms with, drugs or surgery and stuff like that. D.O.s are licensed in all 50 states. I should go ahead and mention that as well. All 50 to practice medicine and surgery and to prescribe medications. So it's a little bit different in that regard between, psychiatrists versus psychologists and people who get a degree in it's called a PsyD. So instead of a PhD in psychology, they get a PsyD. And a lot of people with PsyDs are able to prescribe medication, but only in certain states, I believe. The last time I looked into it, it was still only in certain states. So it's a little bit different for D.O.s versus, the psychological community. But D.O.s can specialize in internal medicine, family practices, OBs, general surgery, pediatrics. They just spend a lot more time with people. If you really want a human connection rather than just a doctor-patient connection, a D.O. may be good for you. They have a whole bunch of extra hours on the skeletal system and the interactions of the body with different diseases. And they may have slight personality differences between physicians with a D.O. versus an M.D. In general, though, you're not going to see much of a difference in terms of medical care. You can still get great medical care from an M.D. just as you can from a D.O. They just approach it differently. So it's a medical and lifestyle perspective versus mostly just a medical perspective. A D.O. is going to maybe ask you about your lifestyle, your family, and any unique concerns that you may have in your personal life. If you feel like that might be a little invasive, then you may be, talk to your individual D.O. and say, hey, maybe, I'm comfortable explaining this much, but no more than that. And they may be able to go ahead and accommodate that. But if they are not able to, then maybe an M.D. could be more appropriate for you. That's okay. We're all different folks who are comfortable with different things. If you have a chronic disease like diabetes, then a D.O. is going to ask you not just about the medication you take, but also about your nutrition and diet. What are you eating? Who's at home? How are your meals prepared? Who prepares the meals? They're really going to dig into the supplemental layering that's going to give you more information about really having holistic care and your wellness. So I like D.O.s because they're not just sick care, they are really health care in general. Now with an M.D. versus a D.O., there's not a lot of differences aside from mostly their bedside manner, and that they may go ahead and recommend yoga and meditation to you and talk about your nutrition rather than just going, okay, here's your medication, I'll see you later. My nurse practitioner, though, is fantastic, and she operates a lot like a D.O., and I really appreciate that about her. She'll ask me about what's going on in my life. Also, my veterinarian, interestingly enough, does that as well. When we had to put down our dog a few years ago, she was very good about asking us about how we were doing emotionally when we came in with the cat later on. And that was really meaningful for me. I was like, I wish I had a doctor who had a bedside manner like this and who remembers individual patient concerns. She's very awesome, and I still will drive my cat like an hour up to see her because there's just no one like her as a veterinarian. I'm grateful that now I have my solid nurse practitioner as well who does have that kind of perspective too. So you can be all kinds of different doctors and still have these type of mannerisms. So just because you might feel that maybe a D.O. isn't right for you, that's okay. You can find an M.D. or a nurse practitioner who may really have a very similar approach, but might not go as in-depth or focus as much on personal aspects if that's what you're not really comfortable with. So when you're deciding between the two, really you want to see, what is more comfortable to you. That's all it really is. Who are you as a person, and what do you want in a healthcare practitioner? If you want more questions asked of you, maybe a D.O. If you just want to get in and out and you don't really want to focus on that stuff and you're fine with just the Western medicine approach, an M.D. is great too. Right now, the Doctors of Osteopathic Medicine are going and getting their bachelor's degree first, and then going into 4 years of medical school, and then they have a rigorous national licensure exam, which is the same material that people have to take to become an M.D. So they have to pass the same tests. If that was making you uncomfortable, it is the same test. They're both licensed by state medical exam boards as well. Their residencies last anywhere from 1 to 7 years, depending on the area they've chosen to practice in, so internal medicine versus family practitioners and so on. And then they'd also do the additional musculoskeletal framework, regardless of which area they had chosen to focus in. Although a lot of them graduate from traditional medical schools, a lot of interest in osteopathic medicine is growing, and there are now over 35 accredited colleges for it in the U.S. So keep that in mind as well when you're trying to select it. We're going to go another break, and when we come back, we're going to talk about the differences between a D.O. and a naturopathic doctor, as well as the type of tests that D.O.s can perform.
Tired of searching the vast jungle of podcasts? Now listen close and hear this out. There's a podcast network that covers just about everything that you've been searching. Hey! The Golden State Media Concepts Podcast Network is here. Nothing less than a podcast bliss with endless hours of podcast coverage. From news, sports, music, fashion, cooking, entertainment, fantasy, football, and so much more. So stop lurking around and go straight out to the Golden State Media Concepts Podcast Network. Guaranteed to fill that podcast itch. Whatever it may be. Visit us at www.gsmcpodcast.com. Follow us on Facebook and Twitter, and download us on iTunes, SoundCloud, and Google Play.
Welcome back. Before the break, we were talking about the differences between a D.O. and an M.D. Now we're going to talk a little bit about naturopathic doctors in comparison with D.O.s as well. So a naturopathic doctor attends a 4-year graduate program in naturopathic medicine. So they have to go get a bachelor's degree as well, just like D.O.s and M.D.s. And then they attend the graduate program in naturopathic medicine. And then they have to pass an exam that is given to them by the Council on Naturopathic Medicine Education. So that is different from a D.O. and an M.D. D.O.s and M.D.s have the same tests, the same licensure type exams, but naturopaths are unlicensed and they are not educated in the same methods and same degree as D.O.s. D.O.s and N.D.s, naturopathic doctors, do share a basic philosophy for treating people though, and that's that the body has the ability to heal itself in certain capacities. What naturopathic doctors can and can't do is going to vary widely depending on which state you live in the U.S. or which state you're in at the time. So D.O.s and M.D.s licensed in all 50 states, N.D.s unlicensed, and the state laws are really going to depend on what you're able to get from an N.D. In some states, a naturopathic doctor can be a primary care physician and can diagnose and treat patients with natural and homeopathic approaches, but they're not able to prescribe medication. In other states, they're far more limited than that. A D.O. is different in that regard. So if you're looking for a licensed doctor who also does Western medicine plus natural things, a D.O. is a good solid middle ground between an N.D. and an M.D. Some D.O.s do use alternative and natural approaches, so like CAM approaches like we discussed in a previous podcast, but many also rely on conventional treatments and methods. But again, you're their partner in trying to figure out what is right for you. So when you're talking to a D.O., they're really going to take into account what you're most comfortable with as well. And if you're more comfortable with homeopathy, then they may be recommending more of a natural approach. Although they will still tell you, hey, this is also a bacterial infection. You need antibiotics for this. What's the difference between a chiropractor and D.O.? Well, we touched on that in our last podcast. And they both work on the musculoskeletal system, and they're trained in manual adjustment of the spine, but a D.O. is licensed to prescribe. Chiropractors are not. And chiropractors primarily focus just on the musculoskeletal system and manipulating the spine and working on mobilization techniques to help you. They are the ones who are more likely to crack your back if that is what you are looking for. So unlike D.O.s, they aren't licensed physicians. They're generally not required to complete residencies in approved facilities either. There's just less regulation for that as well. And they're really just looking at your spine for the most part, just your musculoskeletal health. They can work on your extremities as well. In general, though, they tend to focus on spinal health when they're looking at your musculoskeletal health. And that's what we think of when we think of chiropractors. So with the D.O.s versus chiropractors, if you're wanting just a mind-body connection kind of approach and you're looking at that for your overall health and wellness, then you'd want to see a D.O. If you really just want some pain relief in the meantime, then, go see a chiropractor and they can go ahead and crack your back for you, or go see a massage therapist and they can give you a massage to help you with your physical therapy type needs. Now, the National Center for Complementary and Integrative Health says that chiropractors focus mainly on those manipulations. So again, they're going to crack your back. That is up to you as to what you're looking for. You could see both a D.O. and a chiropractor. A D.O. may even be comfortable with, going ahead and referring you to a chiropractor or working in tandem with a chiropractor, and they may be able to give you some good recommendations for nice, rational chiropractors in your area who they believe are very medical-minded, very science-focused. So osteopaths do have specialties. You can get a D.O. for your kid if you're looking for a pediatrician. You can get a D.O. who's a surgeon. You can go online and search for D.O.s in your area. A lot of times I use the program ZocDoc, ZocDoc.com. And ZocDoc allows me to just go in there and talk about my specific needs for what type of doctor I'm looking for. It also lets me talk about what insurance I have and helps me search for doctors who are in network versus out of network. And you can even often book appointments online. Now, ZocDoc does not always give you a list of all of the doctors that are out there. It's just the ones who are also registered on ZocDoc. But I like it because it also sends me reminders of when my next healthcare appointments are and when I should be making another appointment. So if you're like me and you forget to make your appointments and you're not sure when your last, eye exam was, then go ahead and maybe consider ZocDoc. It's free and I really enjoy it. I tie it to my Gmail account and then they can just send me the reminders so I can make those appointments. But you could search through doctors in there too. That's how I found a lot of my doctors. That's how I found my dentist and all that jazz. So I recommend it. That's not related necessarily to osteopaths in general. That you can find osteopaths on there, but you can do a search on other websites as well, specifically for Doctors of Osteopathic Medicine. Now, what kinds of tests and procedures can osteopaths perform? They can do urine tests, biopsies, blood work, x-rays, MRIs, you name it. So you don't have to worry about that. You can still get that done. Just keep in mind if you're going to a D.O. at an urgent care facility versus at a primary care practitioner facility versus a hospital, that the hospital versus primary care facility versus urgent care facility may have different equipment available. So when my sister's appendix ruptured when I was a kid, we went to urgent care first. And they're like, okay, we're not equipped to handle that. But we were just out in the middle of the sticks, and that was the first place that we could reach. That was a medical facility beyond just the tiny, country family doctor facility that we had out there. So they're like, okay, yeah, she definitely is having, her appendix is ruptured. She definitely needs to go to a hospital. She needs to go to the ER. So we had to go to the ER at that point. Not because those doctors weren't able to tell what was going on with her. They were able to diagnose her and everything, but they weren't able to perform surgery because the facility was just not equipped for it. So keep that in mind when you're also looking for your doctor. If your D.O. is at a place that it's not going to have the equipment that you need for what you're looking for, you may want to find a referral to a D.O. who does. They can also treat patients of all ages, and they use allopathic and osteopathic medicine. Is really what it comes down to. It's been around since the 19th century. So remember that guy came up with it in the 1800s. He was an M.D. and was like, we need to focus more on helping the body heal itself rather than just performing all these other, chemical treatments and such. And a lot of studies have shown that osteopathic manipulative treatment is safe and effective for pain relief during pregnancy. So I think that's really interesting as well. So if you're having migraine and lower back pain, or you are having some musculoskeletal pain in pregnancy, then you might want to go see a D.O. and they can really assist you with that. A 2017 review found that while researchers have verified some positive outcomes for patients, they need to conduct some more studies for the osteopathic manipulative treatment and its effectiveness overall as a treatment rather than just as pain relief. So that is something to keep in mind. But it's been a couple years since then. Hopefully we'll have some more research coming out soon that we can reference as well. In the UK, their national health system says that while manual therapies have been effective in treating osteoarthritis and lower back pain, they believe there's little evidence so far for osteopathic treatment of many other medical conditions. And in that concern, I think that they are discussing the osteopathic manipulative treatment. So that extra 200 hours they go through, not the holistic approach per se, but the hands-on approach that's more like chiropractic medicine. So this is very similar to what manipulative treatment in chiropractic medicine has looked like for their research outcomes, is that a lot of the time it's for pain relief management. So the UK NHS is just not sure if that extra 200 hours of the osteopathic manipulative treatment is what is really promoting long-term healthcare outcomes or whether it's just there for short-term pain relief. Either way, whether you're going for pain relief or just a different medical approach, find out what's right for you. We're going to go on another break. When we come back, we're going to talk about the mind-body connection as it relates to osteopathic medicine.
The GSMC Life and Happiness podcast takes you on a journey of exploration. We'll discuss tried and true methods alongside the latest trends of how to best live your life to its fullest and happiest. From psychology to meditation, science to self-help books, the GSMC Life and Happiness podcast will help you to discover what makes you happy and how you can live life being the best you possible. Download the GSMC Life and Happiness podcast on iTunes, Stitcher, SoundCloud, Google Play, or anywhere you find podcasts. Just type GSMC in the search bar.
Welcome back. Before the break, we were talking about the differences between N.D.s and D.O.s and M.D.s and really what all the differences are between the different types of physicians and folks that you can see in the U.S., whether they're accredited and recognized as physicians or not. Now we're going to talk about the D.O.s approach to the mind-body connection. So they think that therapy, medication, exercise, and nutrition can all play a role in improving not just physical health, but also your mental health. So for D.O.s, they treat patients with mental illnesses as well, and that is a natural application of their osteopathic emphasis on treating not just the mind and body, but also the spirit. So mental disorders are common in the U.S. A lot of us have depression and anxiety at this point. 18% of adults had a mental illness in 2014, and 20% of American children have had or currently have mental health issues, according to data from the National Institute of Mental Health. Now, William J. Resch, he is a D.O. and an osteopathic psychiatrist in Columbus, Ohio, because again, remember they can specialize in just about anything. He says that the holistic emphasis of his osteopathic training really helped him create a new foundation for his current approach in his medical practice. He says, "We can't focus only on neurotransmitters when diagnosing and treating mental health. We also have to look at each patient's past experiences, physical health, and the socioeconomic, cultural, and spiritual issues that are affecting him or her." There are a couple different ways that D.O.s do that. One doctor will treat them with low-grade depression and anxiety by urging them to think about ways to improve their mental health and to think broadly about it. Patients a lot of times will reach for medication as a quick fix, but that can only go so far according to some doctors. They want you to look beyond medication to other behaviors that can help you really be the best you. So, for example, you can nurture your mental well-being through physical activity. Now, that's not going to say that just going out and exercising is going to fix depression or anxiety or anything like that. remember, this is an integrative healthcare approach. So they are going to use allopathic and osteopathic medicine. So you can do both, but they're going to urge you to take a well-rounded approach to it. So even if you are on medication, they also encourage you to do physical activity. In my personal health and wellness approach, if I am feeling upset, I will go to the gym. A lot of times I just need an outlet for that upset, whether that's anger or sadness or frustration, and going to the gym helps me get some of that out. It helps me release a lot of like the nervous energy that I have going on, or any of the negative energy I may be experiencing, and it helps me put it into a positive framework. So that's partly my approach to it, and I really enjoy that about D.O.s. If I am feeling sad or I've had like a really low mood for a few days, then I will start thinking, okay, what about my gut health? Serotonin is made in the gut. Have I been eating fiber and stuff to help my gut, help me be the best me I can be? No? Okay, time to go and make a salad. I should probably do that today. That would be really good for me. But overall, I am going to go to the gym today. I've been feeling kind of bummed out today, so I'm going to go to the gym. I'm going to have some good fiber in my diet, some dark leafy greens. I'm going to have maybe some oatmeal or something. And I'm also going to spend some time with my friends online. I'm going to cultivate healthy relationships as well. So I'm taking that mind-body approach to treating not just my physical body, but also my mind. Eating well and exercise are good for our mental health, just like they are our physical health. And it's helping me to manage my stress. So finding these different outlets is something that a D.O. is going to really encourage you to do. And I encourage you to check that out as well. It's totally fine to take medication for whatever's going on in your life, in my opinion. I take medication, but I also take an additional approach. I want to give my body and my mind the best shot that I can at being happy and healthy. So that's what a lot of D.O.s do in that regard. And they're going to also perhaps connect you with psychotherapy. So going and speaking to a psychologist or a psychiatrist. If the D.O. is a psychiatrist, then, you're already where you need to be for that. But it can help you address any unhealthy behavioral issues you have. So a lot of us have bad habits, and part of going and fixing our problems is admitting that we have one to begin with. It's okay to admit where we are on our own personal journeys and go, okay, this is what I need to work on. Sometimes we are the toxic person in a situation, or sometimes we have toxic traits that we need to work on because they're not setting us up to be our best selves. So in that way, D.O.s may redirect you towards psychotherapy or cognitive behavioral therapy. There are a lot of different approaches that psychologists take, and D.O.s may recommend a psychologist or a psychiatrist or a counselor. It just depends. So counselors can be people who have a degree in social work. People think of social work as just folks who work with taking people's kids and the foster system, but that is not all that social workers do. Some of them are licensed counselors as well, and some of them work in policy. So you could see someone who's trained in psychology versus counseling for their degree versus social work. It just depends, but they may refer you out for psychotherapy too. As D.O.s, they really believe that people have an innate ability to heal themselves, not just the way our body works, but also by the way we think and act and make our everyday choices. So if we're sitting here eating just cookies every day, I say that because I really want a cookie right now, but if I just sat here and ate cookies every day, that's not going to be great for my body. I can't survive off of cookies alone, much as I wish that I could. However, I need to have some greens. I need leafy greens. I need proteins. I need healthy fats. I need all of those good macronutrients to really help me live my best life, to help my brain have enough, juice to really think, and my heart to be able to pump blood appropriately. I can't just live off of caramel macchiatos and those delicious Belgian chocolate cookies that you can get from Trader Joe's. I'm obsessed with those right now. They're so good. They're almost like a chocolate ganache inside. It's not quite a ganache, but it's oh my gosh, it's so good. I digress. Thinking about cookies too much. But D.O.s may also encourage you to think about your personal habits and behaviors. So when I say, your diet and exercise, they're not trying to harp on you and just going, hey, you should perhaps lose some weight or focus on getting some more muscle tone. They're really going, hey, let's focus on your healing and wellness overall by taking these approaches. Let's work on your behavior and your habits by going to the gym 1 time a week for 10 minutes or, starting with 3 times a week to form that habit really, even if you're only going for 5 or 10 minutes and walking on the treadmill, just establishing new patterns of behavior and habits to help you break the old negative, repetitive patterns of thinking and acting. So in a 2014 study, they found that children and teens who had an unhealthy diet were more likely to have poor mental health. A lot of mental health and physical problems go hand in hand, and you can get double benefits from diet and exercise. So yes, exercise and dieting has helped me to really tone up these past few months, helped me lose some fat weight that I was carrying and some water weight, but also it's helping my body tone up and helping me to not be in pain so much, as well as helping me to have better mental health overall. It helps me to be a kinder, gentler Alex. And if you are on a 2020 mission to be a kinder, gentler you can also try approaches through exercise and diet in addition to, doing your journaling and your shadow work and everything else. You can get double benefits from it. It can help your brain and your body, or your mind rather, and your body. If a patient has diabetes or chronic pain, they are also more likely to suffer from depression or anxiety, which can make it harder for them to manage their health. Feeling better starts with your diet and nutrition and exercise, according to a lot of D.O.s. Now that said, when I was very depressed, it was really difficult for me to go and make those good meals and stuff. So instead of focusing necessarily on making good meals, I focused on not bringing as much junk food and stuff into the house. That was my primary goal, because if it's not in the house, I can't turn to it when I am feeling sad or upset. I can instead reach for something healthier. Now, as we discussed before, juice is not that much healthier than soda because of the amount of fructose that's in it. However, a lot of sodas also have Karo syrup added in there. So if you get a fruit juice with no sugar added, yes, it has more fructose and you need more fiber to go with it, but I can eat a piece of toast with my juice and get some fiber along with, the sweetness that I'm craving. Or I can grab a tangerine, which is even better for you because it does have the fiber in that whole fruit. So I reach for fruit and stuff because I don't keep a lot of junk in the house. I do have those cookies, but there's not a lot in those Trader Joe's packages, so I just don't bring a ton of them in the house. And I don't bring sodas in the house. So if you're having trouble with breaking those habits, then make it harder for yourself to turn to those habits. Now if I want a soda, I have to leave my house for it. I have to drive to the gas station or McDonald's or the grocery store to go and get it. And a lot of times for me, that craving is just not worth it. I'd rather have some apple juice or a piece of fruit to satisfy that sugar craving. That's just making my own habits and behaviors work for me rather than against me. So in this case, I don't have a lot of time to be going out and running around doing that kind of thing. And also, part of it's laziness. I don't want to have to get dressed for the outside world and put on shoes and a coat and go out there just to get a Coke. So I am making that work for me. So you can make your negative traits work for you. Or, really, we don't want to think of them as negative per se. If we're thinking about Carl Jung's shadow and the ego, it's really just integrating our shadow selves in a way. That type of laziness is more of a healthy expression of sloth than, just laying in bed all day, rather. I'm not laying in bed all day drinking Coca-Colas at this point. I just am not going out to get a Coca-Cola. I am instead drinking water. So it just depends. I do love Coke, though. I get Cokes when I go out sometimes. It's like a treat for me. So you can have those things every now and then as a treat. We're going to go on another break, and when we come back, we're going to talk about some more D.O. approaches.
Are you tired of the same old news? Are you sick of the seemingly endless political spin and negativity? The GSMC America Still Beautiful podcast is a weekly news podcast covering all the top positive and uplifting news stories. We cover stories that will inspire, uplift, and remind you of the good in the world. Tune into the Golden State Media Concepts America Still Beautiful podcast to get all the great and positive news stories of today. Download the GSMC America Still Beautiful podcast on iTunes, Stitcher, SoundCloud, Google Play, or anywhere you find podcasts. Just type GSMC in the search bar.
We were talking about some D.O. approaches to diagnosing and treating people using the mind-body connection. Now we're going to talk a little bit more about that and about some of the ways that D.O.s apply their research. Since D.O.s do take the mind-body approach, there have been D.O. doctors who have found that certain physical health problems unleash some symptoms that mimic mental health disorders. So, for example, Dr. Resch says that he's lost track of how many times he's discovered an undiagnosed medical problem like a thyroid disorder or kidney issues that were masquerading as depression. So it was manifesting in a different way because your thyroid is associated with certain hormones and different chemicals in your body, just like your kidneys are and your adrenal glands. So it can manifest and cause depression. And so people think that, I'm just depressed, and they try to treat it with different types of medication, when instead it is coming from another causal agent like the thyroid. It's not just that they're depressed and they neurochemically need medication, but rather that if they treat the real underlying cause instead of the symptom that is depression in that case, then it can really fully treat it and perhaps even cure it at a certain point. Another D.O. named Dr. Palini works at an army base where he primarily treats soldiers who've experienced concussions. A lot of them in his experience have interrelated behavioral and physical health issues. So he says that if he has patients in his waiting room, he will walk them himself from the waiting room to his office to see how they behave in a more casual setting first. I think we're all a little bit different in the waiting room versus in the actual exam room versus in our own homes or in our cars. So he likes to see these different perspectives as well. And he says that if he's treating for PTSD and the patient also says that they have physical pain, then he looks at the whole picture. And he'll ask about pain or the person's social relationships, marital, financial problems can also contribute to a lot of stress and cortisol in the body, which is going to be, those tensed up muscles too. And he says you really have to understand what the patient is living with or living through before you can address their whole behavioral health effectively. It's not enough to just go ahead and go, oh, you're depressed. Do you want to go to psychotherapy or do you want medication or do you want both? I can refer you out to either, which is typically what M.D.s tend to do. Instead, he's going to go, hey, what else is going on in your life right now? I understand you're stressed and you're having some issues with PTSD right now and you're in physical pain. Where does it hurt? When did it start? Is there anything else going on in your life, not physical, that could be causing part of this? Are you in financial distress? Are you worried about anything in particular? Tell me a little bit about it. So I really like that approach, and it's very fascinating to me that that is a possibility nowadays, because my mom has had lots of surgeries throughout my lifetime, and she and a lot of other women, as this has been scientifically studied, have an experience where doctors do not always tend to listen to women about their symptoms. Even if they're not consciously biased towards women, or they're not consciously, not listening, sometimes they still do it anyway. A lot of our biases can be unconscious or subconscious. I've also had a similar problem. I went to a doctor when I was in my early 20s, and I was like, hey, I'm still having this leg and hip pain, and I've had it my entire life. And he brushed me off, and he was like, oh, that's just growing pains. Well, as an osteologist, a biological anthropologist, I know for a fact that that is not true. I know exactly when my growth plates fuse, because the sequence of your bones fusing, it happens in a sequence time progression. It's dependent upon sex, and that is about it. Male versus female in regards to when our bones fuse. And once they fuse, those epiphyses, the ones that are on the end of the long bone shaft, which is your diaphysis, once those fuse together, then growth stops. Those are your growth plates fusing together. So I knew for a fact I had been done growing for a long time, not just because my height had been the same since I was like 14, but also because biologically that is the way that it works. And so this doctor totally dismissed my concerns and instead tried to just give me the Gardasil vaccine. And, that's understandable. I know that part of his job is to promote these vaccinations and everything, but he completely dismissed my concerns and my primary reason for being there. So I essentially paid for a doctor's visit to not get what I needed, because he was entirely dismissive of my specific pain and was ready to just chalk it up to growing pains, which is what it's been chalked up to my entire life. I still have those pains at 31. It is definitely not growing pains, I can tell you that. But my whole point is that perhaps seeing a D.O. would have been a much better option for me or my mom or a lot of other women over the years. So if you have experience with doctors not really listening to you and you feel like you're not being heard, then a D.O. might be right for you. Or a nurse practitioner. I'm a big fan of those. So we're going to talk a little bit about osteopathic research real quick. They are really interesting what they tend to look into. So they're very interested in all aspects of wellness. And they've done some studies with the American Osteopathic Association. They've conducted some Harris polls and have found that 71% of Americans rate their overall health and wellness as good to excellent. So 54% said it was just good, 17% rated it as excellent on a scale that went up to excellent. Americans in the study were asked about their sleep, their work and exercise habits, and any concerns they had about politics, the environment, access to health care, and so on. So this was a very holistic study. It's taking into account, your physical wellness habits, also the things that can impact your mental health and your emotional wellness, like your sleep and your work and how you feel about politics and the environment. Because if you're worried about climate change, then that can really impact you negatively regarding all the stress in your body, depending on how concerned you are about it or concerned about the political climate. Now, I'm definitely not saying don't worry about those things. I am very invested in socio-political and sociocultural issues, but I am also saying that it could be a component in your overall health and wellness. And that's what they were taking into account. So I truly appreciate this anthropological perspective. The findings really tell us that Americans are doing the best we can in a challenging environment. So the good news is that a lot of people are doing everything that we need to be doing. We're trying to get enough sleep. That's 7 to 9 hours per night of straight sleep. We want to make sure we're sleeping through the night if possible, so we can get the appropriate REM rest. we want to make sure we're not burning ourselves out at work. And a lot of folks in the study weren't. On average, people were exercising more than twice the recommended amount. So that's really great. On the other hand, when we think about holistic health, we also want to think about the things that are outside of our control, like the environment and to a certain extent, the socio-political issues as well. So when we are thinking about that, there are certain things we can do and there are things that we can't. We can work on our political engagement. If politics is really concerning us, we can try to take a vested interest in that and go to our city council meetings and stuff to make sure that our voices are being heard. Even if you just feel like it's helping your voice to be heard, that can impact your mental and emotional wellness in a positive manner. It can make you feel that you're doing everything that you can, because not everything is in our control, but there are certain things that are. Go pick you up some signs, put them in your yard. It all just depends on what in particular is bothering you. You can advocate in your local town for positive environmental measures. When I was student government president in college, recycling was very important to me. This was about 10, 15 years ago at this point. But I started a recycling program at my community college. It wasn't even that hard. I just had to contact certain people in the city and go, hey, we want in on recycling as well. And they got us the bins and everything. I also installed a pool table, but that was for everyone's emotional wellness at that time. It was an area in the school and an activity for people to use to let off steam. It was very chill, and that was also easy to obtain. So we are going to address the things that we can, and sometimes those are really creative solutions that you might not otherwise think of if you think of health as just being sick care and preventing and treating being sick instead of viewing it holistically as wellness like D.O.s do. All right, we're going to go on another break, and when we come back, we're going to talk a little bit about some more D.O. research and how that really interplays with activities like yoga and esports. Stay tuned.
GSMC Beauty Tips Podcast gives you advice on everything from hair to fashion to skincare products. We'll talk about the latest trends in makeup, hairstyles, and anti-aging remedies. And we'll cover all of the newest fashion trends. If you have an interest in or questions about the beauty trends that might work best for you, the Golden State Media Concepts Beauty Tips Podcast has got you covered. Download the GSMC Beauty Tips Podcast on iTunes, Stitcher, SoundCloud, Google Play, or anywhere you find podcasts. Just type GSMC in the search bar.
Welcome back. Before the break, we were talking about D.O. approaches to treatment, and now we're going to talk about some of their research and how that relates to activities we enjoy every day, like esports and yoga. So these scientists have found, D.O. researchers, have found that there are a lot of different factors that impact Americans. One of the big ones they found is that 3/4 of Americans are lonely. 71% of Americans, as we discussed in the last segment, rated their overall health and wellness as good or excellent, and that was true for about 60% of people with a household income of less than $50,000 per year, and 81% of those with a household income of $100,000 or more. So on the one hand, it looks like money cannot entirely buy happiness, but it does help by about 21%. When asked what areas in their lives needed improvement the most, the top two choices Americans selected in this survey were physical health at 42% and financial stability at 41%. Mental health was third, so 29% of Americans said that that is what they needed the most improvement in their lives. And its need for improvement was higher among younger groups. So ages 18 to 34, 44% said that mental health was very important for them, And the next age bracket that they've set at 35 to 44 was 37%. And then it just gradually declines a little bit as it gets further along. Now, it's definitely a reality that mental health has become more mainstream in the past couple decades. And that's really great because it means that there are now more workplace wellness goals that are targeting mental health. And indeed, this new generation, millennials and some of the rising Gen Zs who are entering the workforce are really wanting mental health requirements from their prospective employers. And I think that's really great because it's a whole principle of supply and demand, and people are really demanding it now. So hopefully we'll get it supplied more. This poll might really be showing that younger people are more acutely affected by stressors as well, though. So it might not just be that their mental health is an issue because mental health is an issue. It's not the problem in and of itself, but rather that they may be having other issues like financial instability and political concerns. So I know it's certainly true for a lot of folks in my personal life that with all these outrageous student loans and everything, and being a millennial, we're just not able to buy houses and stuff like our parents were. The model of what was set forth when we were children as to what a good life should look like and what we should strive for is not necessarily the reality of what is tangible today. So that can really be stressing us out. That is why that 18 to 44 age bracket comprised, a lot of mental health concerns. Those two age brackets primarily comprise the folks who were the most concerned about their mental health. So again, it's a holistic nature. I find that a lot of times in research, as well as in general life, certain problems, particularly related to stress, are typically not just one thing. It's kind of the straw that broke the camel's back type of a principle. And it's very similar to when I do my shadow journaling, that I start out writing about what I think is bothering me and then find out that there's other things that are bothering me, or that that's not truly the thing that's bothering me the most. It's just the culmination of everything else has led to that one thing being the final too much. So in that regard, that's pretty much what the D.O.s have found as well. They also asked in the survey what was missing in healthcare. Some of the options were like geographic proximity to having healthcare facilities near them or having them be more affordable. Over 39% said dental care and 33% said primary care or a family physician. Remember, there are a lot of urban and rural underserved areas, and that is very likely where a lot of these folks are coming from. So just because a lot of us are privileged to live in areas with a lot of doctors available and affordable health care available, and having doctors who will take our insurance for those of us who have insurance, that doesn't mean that's the reality for a lot of other people. And these numbers are really reflecting those concerns. 24% said they wanted better access to emergency care, and 21% said psychology and psychiatry. 19% said they wanted more specialty care, like oncologists or cardiologists around their area. They said that they were most concerned with the findings in the study that said between 1/5 to 1/3 of Americans wanted better access to critical components of healthcare. So having an oncologist nearby who is good and takes your insurance, if you have insurance, is very important. You need an oncologist at that point. I don't think that you can treat cancer solely with homeopathy. You need some Western medicine, in my personal beliefs. And it's a little alarming that they don't have oncologists and cardiologists, any type of specialists available in certain areas. I know when I was growing up, my hometown did not have that at all. They still don't. You would have to drive to the next biggest city over to get certain types of care. And when my mother had cancer, she had to drive like an hour and a half, 2 hours away to get the care that she needed for it. It was a lot for her to take on, particularly with financial concerns, having to drive that far. You had to be able to get the car for that long and gas money. There's a lot more that goes into it than a lot of folks think. And that's where D.O.s come in, because they can really take that into account, just like nurse navigators do for people who are going through cancer treatments. Nurse navigators are amazing people, and they really help you out in determining exactly where to go next. And I think having them in concert with a D.O. would be exceptional. Although my friend who is experiencing cancer treatment right now, her M.D. does recommend certain supplemental herbs and stuff depending upon what she's most comfortable with. She does that in combination with chemo and radiation treatment, and it helps her out a lot. And she says that her friends in Canada, where medical marijuana is legal everywhere, a lot of the oncologists up there recommend medical marijuana in conjunction with going through these cancer treatments with chemo and with radiation. I think that that is really remarkable, and it's more of a D.O. approach, even if most of these folks are M.D.s. So even if there aren't any D.O.s available in your area, so if they're not a lot of them around because of access issues, you can still perhaps find an M.D. who's amenable to that. You just have to go in and speak with them candidly about what you're wanting from your healthcare treatment plan. Especially if they're nurse practitioners. In my experience, they tend to be very chill about that. In addition to having a nurse practitioner as my primary care physician, I also have a nurse practitioner as my GYN. I really prefer having nurse practitioners in a lot of ways, and I enjoy going to see both of them. They take a lot of the stress out of it for me, and I pick them out on ZocDoc. So I really recommend that. You can pick them out based on their photos as well. So their photos are up, and I'm just like, okay, I like this person's smile. They seem genuine, and the smile lights their eyes. I like their credentials. It'll often tell you where they went to school as well. And I like being able to have all of that technical information in addition to the photo of the person as well, and any reviews that might be up there. So again, I will recommend using ZocDoc. I don't get paid to say that or anything. I just really like it, and it's helped me out a lot. So I thought it might help you guys too. So in addition to all of this, a lot of the doctors have also studied what keeps us up at night, and they found that political divisiveness is more of a concern for older age groups than younger age groups. So only 25% of the 18 to 34 age bracket said that, whereas 65 and older, that was 59%. And it gradually steps up for each age bracket. So we're seeing the exact opposite for the divisiveness as we are for mental health care. So it's very interesting to me how that's inversely related. In esports, they did a study in the Journal of the American Osteopathic Association and found that a lot of folks in esports get overuse injuries just like any other athlete. So not only are they sitting in this chair all day practicing and playing these games, but they are also having trouble with things like tendinitis, blurred vision from excessive screen time, neck and back pain from not having good posture while they're sitting there, and even carpal tunnel from repetitive motion. From sitting still all day, you can also get metabolic dysregulation issues, particularly if you are drinking a lot of sodas and stuff or energy drinks while you're playing games, and then they get depression and anxiety sometimes from what they're calling internet gaming disorder. So they're not saying don't play esports. Just if you're going to be playing esports, we need to really be addressing other concerns in our wellness. So we want to make sure that we still go and work out and stuff. I Twitch stream a lot now under the name Sharknado Week, and although I do that pretty much every day, I do also go to the gym, and I make sure that I limit myself to 1 caramel macchiato per day. I am drinking a lot of water. It's primarily what I'm drinking on my streams. And I also will drink green tea. So I'll swap over to like sencha or something if I'm wanting to have something with a little bit more flavor in it, but not necessarily sugar, because I'm trying to just wean myself off sugar as much as possible. I make my own caramel for the caramel macchiatos now, and I use a lot less of it, and also it doesn't have any Caro syrup in it, like the one that I was using when I started hosting this podcast and first started talking about caramel macchiatos every week. So it's really interesting to me how you can make those little changes yourself. I have an ergonomic gaming chair now, and I've also put one of those little ergonomic mesh and wire things. I'm not sure exactly what they're called, but they're for lumbar back support. I put that in my mid-century modern chair as well. So when I'm sitting here playing games or just streaming on Twitch, I can be mindful of my posture and also be getting the support I need. I have something under my desk as well to make sure that I'm not getting anything pulling on my lumbar spine just from gravity and my little legs being too short to reach the ground. I have something to prop my legs up on. That helps me a lot. If I get neck and back pain, I will, take a hot bath. I will make sure that I am stretching and loosening those jaw muscles, lowering my shoulders, and not overdoing it with the playing of the games so I don't have a lot of wrist pain. If I've been playing the Xbox a lot, then, maybe I'll switch to a game that uses a mouse so my hand shape is a little bit different. Or sometimes I just sit there and talk to people. That way I'm not exacerbating my tendinitis, because I did start being prone to tendinitis really a couple years ago when I was working multiple jobs online that required me to type all day, and my volunteer work was also on the computer all day, and it was a lot for me. I was in pain a lot, and now it's working a lot better for me because I work on my flexibility and lowering my stress and working on not being quick to anger as well, just retraining my brain in general. So I'm approaching that holistically like a D.O. would have me do. And they've also found that people who participate in a lot of esports, so esports athletes who do this a lot for like a living, only 2% of people who were in this research study actually went and sought medical treatment. Only 2% of the people who said they had an ailment, like the 42% with the neck and back pain, 36% with wrist pain, and 32% with hand pain. So if you're doing esports, I really recommend getting into ergonomics. And if you're having a lot of these pains, go speak to a doctor before it gets like really difficult and painful. 40% of the people surveyed in this study also said they get no additional physical activity in a given day. So it can be really physically demanding, even if you are just sitting in a chair all day playing these games. It's not what you would think of as being physically demanding, but it is working out those tendons and those ligaments. It's also causing muscle strain, eye strain, etc. It can cause problems just in different ways than we normally associate with sports. So in that way, we want to make sure that you are training your muscles and working on strengthening them and their flexibility to make sure you're optimizing your performance and maintaining long-term health. Think of it this way. The more fit you are, the longer you're going to be able to play these games. It's going to be great. All right, guys. Thanks for hanging out with me today. And I want to thank you for listening to the GSMC Health and Wellness Podcast, brought to you by the GSMC Podcast Network. I'd like to ask that you please remember to subscribe to the show, and writing a nice review always really helps us. Also, if you can please follow us on Facebook, Twitter, and Instagram, I'd appreciate it. Thank you kindly, and have a good night.
You've been listening to the Golden State Media Concepts Health and Wellness Podcast, part of the Golden State Media Concepts Podcast Network. You can find this show and others like it at www.gsmcpodcast.com. Download our podcast on iTunes, Stitcher, SoundCloud, and Google Play. Just type in GSMC to find all the shows from the Golden State Media Concepts Podcast Network, from movies to music, from sports to entertainment, and even weird news. You can also follow us on Twitter and on Facebook. Thank you, and we hope you have enjoyed today's program.